Your hospital just spent millions on a new EHR, or a workforce management system, or an AI-powered clinical decision support tool. 6 months after go live, adoption is low, staff are frustrated, and leadership is wondering what went wrong. Here is the hard truth. The technology probably works fine. The problem is almost never the technology. After 35 years in clinical nursing and 25 years implementing healthcare IT systems, I have seen this pattern repeat itself in hospitals and health systems across the country. The root cause of failed healthcare transformations is almost always the same: a breakdown in alignment between people, processes, and technology. What alignment actually means, alignment is not a feel-good concept. In healthcare transformation, it means that clinical staff, IT teams, and executive leadership share the same goals, the same language, and the same expectations about what success looks like before, during, and after implementation. When alignment is missing, here is what happens. Frontline nurses receive inadequate training and resort to workarounds. Clinical and IT teams operate in silos, making decisions without each other's input. Leadership approves technology investments without understanding the workflow impact. Change feels imposed rather than co-created, triggering resistance. Post-go live support disappears just when staff need it most, the real cost of misalignment. This is not just a morale issue. Misalignment has measurable financial consequences. Denied claims increase when documentation workflows break down. Nurse turnover climbs when staff feel unsupported through technology change. Patient safety events rise when poorly implemented systems create new points of failure. Research consistently shows that healthcare organizations lose 20 to 25% of potential revenue to operational inefficiencies. And technology misalignment sits at the center of many of those losses. What successful transformations look like? Organizations that successfully navigate transformation share several traits. They invest in clinical change champions, nurses and clinicians who bridge the gap between the IT team and the bedside. They align executive vision with frontline reality before implementation begins. And they measure success not just by go-live dates, but by adoption rates, workflow efficiency, and staff confidence scores 90 days post-launch. This is the work I do with CNOs, CNIOs, and health system leaders through my Clinical Technology Alignment Model, CTAM. It is a structured governance framework that embeds clinical perspective into every phase of a technology transformation. From vendor selection through sustainment. The question worth asking. Before your next technology investment, ask this: do our clinical leaders and IT teams have the shared language, the governance structures, and the communication channels to align around this change? If the answer is uncertain, that is where the work begins. And it is far less expensive to address before go live than after. Ready to assess your organization's alignment health? Book a complimentary 30-minute consultation at stratinformatics.com. Dr. Sophia Brown, PhD, DBA, RN, is the founder of Strategic Informatics Solutions and a healthcare informatics consultant specializing in clinical technology alignment and leadership development. She serves hospitals and health systems across New Jersey, New York, and nationwide.